Namaskar. I am Dr. Rajshankar Ghosh, Senior Advisor with Bill and Melinda Gates Foundation at the India Country Office. Today, I have the pleasure to speak to Mr. Mohammad Suleiman, who is the Additional Chief Secretary, Government of Madhya Pradesh. Mr. Suleiman has led the battle against the COVID-19 virus in the state for the last 2 years since the outbreak in January 2020. The way that the government of Madhya Pradesh has responded to the virus has been exemplary to not only India, but to the rest of the world. From a severe outbreak that was reported in the early days of 2020, particularly from cities like Indore and other places, now government of Madhya Pradesh has reached one of the highest coverages with COVID vaccination. And the result of that is the less number of cases that we are seeing being reported from the state. But let us now hear from the man who has really led this battle from the front in the state, Mr. Mohammad Suleiman. Sir, I would like to begin by asking you as to how did you, in the initial days, plan and execute this program in terms of battling the COVID-19 virus in the state?
Thank you, Mr. Ghosh, for having me here today and to talk to you. It's almost 2 years now we are dealing with the COVID epidemic. Initial days were really tough on us. We hardly had any capacity to test. There were not much of technical knowledge about the treatment part of it. Our healthcare infrastructure was not tuned to it. So we faced initial challenging time during which we scaled up our hospital infrastructure to deal with the COVID patients. We created capacity to test people for COVID-19 and developed our strategy of identifying, isolating, testing and treating. That was the first COVID wave which make us learn a lot of things, and because of those initial efforts, when the second wave hit us, we were quite well prepared in terms of having the capacity in the hospitals to deal with the COVID cases. We still faced a challenge in terms of oxygen availability, as we did not have at that point of time the kind of requirement that suddenly came into. But with support from Government of India and through imports from other states, we managed that difficult periods. So in a way, the way I look at that, our efforts in the initial phase of COVID-19 was to somehow slow down the speed of it, and during that period we could create the infrastructure in the public sector and also in the private sector, create linkages with the private sector to treat patients which we were sending to them, and also train our field staff for easy identification of COVID patients. That helped us to deal with it. We peaked during April of 21, and after that, started slowing down. We are in a much more comfortable position. During this entire approach, we were aware of this, that at the end of the day, though it's not a policy goal, but we had to reach the level of herd immunity either through infection or through vaccination. Since the vaccine was not available, so we kept on trying to delay the spread of the disease as much as we can, so that as and when the vaccine becomes available, we reach that stage of herd immunity.
Right. So one of the things that in public health terms we always say that to prepare for a large kind of control for epidemics or pandemics like COVID-19, there are a 3P strategy that is taken. The first P you spoke about, which is the planning, that the state planned very well and had a direct roadmap as to how to address this issue. The second is around partnership, and the third is around participation, which is people's participation. At your level, sir, where you are at the top of the state bureaucracy, in terms of bringing all the different departments of the government and the private sector and the non-governmental sector, it will be good to hear from you what partnership models you created in the state and how really that was executed.
So, both in terms of management of the pandemic and also during the vaccination program, partnerships have been really, really important. And I mean, there's a long list of partners that we managed to create and managed to work with. Our biggest contributor, of course, was Government of India. In a federal structure, it's really important that the state and central government partner well. We partnered very well with the local municipalities in terms of, getting them on board and rolling out our programs. We partner well with donor agencies like, the UNICEF and UNDPs and Clinton Health Foundation, and number of them. It's very difficult for me to list all of them here. More importantly, we partnered with the medical community within the state in a very successful way. We could onboard hospitals to treat people at our cost. We could create partnership in which we were sending patients and they were being treated at our cost and not commercially. We could also prepare many more hospitals to deal with the COVID. I still remember when we started, we had only one hospital dealing with the COVID cases in the entire state because the rest of the doctors were simply not up to it. Right. And by the end of the pandemic, in May, we had more than 600 hospitals dealing with the COVID patients. So to take this medical community on board, especially in the private sector, I would say, has been really, really important. Then our Chief Minister sincerely believes that no large programs of any kind will be successful unless we totally involve the community into dealing with those things. We have to educate the community, earn their confidence, and then have to work with them. So we created a structure of crisis management group right from state level going up to down to the village. These crisis management group were sufficiently empowered to take decisions about what they want to do in the village. It's like whether they want to have a institutional isolation in their village or they want to have a home isolation in the village. They were given responsibilities of doing the door-to-door survey for identifying suspected cases who can then further be tested through sampling and determine whether they have COVID. And these crisis management groups had participation from political spectrum of all varieties, from religious leaderships, and also from non-governmental organizations, in addition to the government servant. So the biggest success has been because of involvement of community through these crisis management group in the management of pandemic and also in the management of the vaccination program that followed.
Very well said, sir, very well said. Without the confidence of the community, it's very difficult to run programs. And actually, this model that you just described, the Jan Bhagidari model, has become a buzzword in terms of India's COVID management, and various other states are also looking at it. And it's good that you spoke about it and you described the model that you have developed. Let me come back to something which is a little different from what we were discussing. One of the innovations that has really empowered and driven this program is the CoWIN application that, from the point of registration to the point of validation to the point of documentation to the point of certification has actually driven this COVID vaccination program. Now, digitalization is not something which is easily done. There's a lot of empowerment that has to be done. So I would really like to hear from you how you made this a success. And I call it a success because Madhya Pradesh is one state from which we never heard of any problem in terms of using the CoWIN. There must be something that you have done. Please tell us that story.
Well, I must admit that preparing the health team for totally relying on technology and the CoWIN platform has been a challenge, especially in a state like Madhya Pradesh, where large parts of the population is not very technology friendly, so to say. There are network issues, there are technology issues. So it took us some effort to really start and building on the capacity for use of CoWIN. And I would say this has been one of the biggest success story for us. In the initial days of CoWIN, we had issues when we were asking everybody to pre-book a slot and then go for vaccination. We realized that this will simply not work for us. It may work in urban areas, it worked in urban areas to a certain extent, but rural areas, it was not really that helpful. So we decided that we would promote at site registration on COVID. And the way we rolled it out is that we planned sessions on the platform in advance. Most of the time we tried that we will create these sessions 2 days in advance, then educate the community that, because we were following a kind of election model on which our COVID vaccination centers were by and large aligned with the polling booths of the normal elections. So we could plan the sessions there, put up enough number of teams. There were days when we planned almost 14,000 sessions and mobilized 14,000 vaccination teams to go to those session sites and then register the people who are coming there and then vaccinate them. So we were not really banking on the pre-registration. Only thing that we were doing was that we will use COVID to create session in advance, publicize them well, so that the villagers know that they will have their vaccination 2 days down the line and they are not traveling outside during that day. We could publicize, then involve those crisis management group in mobilizing people to come to the COVID vaccination center, make enough arrangements for them so that we could register them at site and then vaccinate them. I still remember during the training programs in the department, I will tell my staff that there are 2 kinds of vaccinations, not one tika, it is basically 2 tika that we have to do. One is the physical vaccination they are doing. Equally important is the virtual vaccination that we are doing. So both the things were going on parallelly, and because we kept on insisting that the virtual vaccination is as important as the physical vaccination, so the health team really took it up as a challenge and delivered. See, we need to understand that this vaccination program is unique. Our entire experience in the past has been vaccinating children. This is the first time we were vaccinating adults, and it needs an absolutely different mindset to deal with that kind of a thing. So unless you use technology, right from your cold chain management to planning your sessions, to arranging your transports, to putting up teams, mobilizing teams, then making their movement plans, unless you use technology, it doesn't really happen. And that is why, in fact, from day one, we were conscious of this fact and implemented it.
Excellent, sir. Nobody could have told this better. And I do hope, sir, and it is my earnest request that please document this particular piece of innovation and how you addressed it. This innovation for Madhya Pradesh, as I heard from you, is so people-centric. That is, people were at the center of the innovation. You made it so people-friendly. This is how innovation needs to be rolled out. I do hope, sir, you document this. I will, sir, I know that you are a busy man, so I would really like to conclude. But before I conclude, sir, I would really like to ask you, is that this conversation that I'm having today with you would be something that would reach out to large number of states and also to many low middle income countries, program managers there, planners there. So any top line message that you would have for them so that, they can start thinking around it?
Well, I'm pretty sure everybody would face the challenges that we faced while we carried out this vaccination campaign. I still remember the vaccine hesitancy that used to be there in the beginning, both in the health staff and also in the community in general. But my feeling is that vaccine hesitancy was removed very fast because the leaders themselves were getting themselves vaccinated. So if a CMHO of a district getting himself vaccinated, the health staff would immediately follow the suit. That was something that we could handle in a very short period of time. The biggest challenge is the logistic challenge when you want to roll out a campaign like this. So my eligible population is almost 5.5 crores. So if I have to give 2 doses to them, 11 crore doses, and the number of sessions that we need to have. In a developed society, we can expect that you will plan a session and then people will come to you and get themselves vaccinated. Not for us, especially in the rural areas. If we just follow this passive approach of planning a session, sitting there happily, hoping the community to come there, it will never happen for us. And that's why we followed this model of community participation and reaching out, that we will go to the public where they want themselves to be vaccinated. It's very difficult for a poor guy to spend one day going for a vaccination.
Right.
Ultimately it's a livelihood loss for him. So we ensured that, in a absolutely planned manner, based on experience of conducting general elections, we reached out to the public, planned this session where they were not to travel. We were going out to them and getting them vaccinated. So to me, I think the bigger challenge is not really the vaccine hesitancy. The bigger challenge is availability of vaccine at the doorstep. Right. It is not only availability, it's the availability at the doorstep where they can get themselves vaccinated in a comfortable manner. That has been the key. And in fact, that is what has helped us now. We have almost touched 94% in terms of the first dose. And many districts have already completed their vaccination. Large part of the population from Madhya Pradesh do travel out, so they might not be available. And these are basically estimated population on which we are working. So we have done almost 95%, 94% in the first dose. We are touching almost 68% of the second dose. We plan to complete the vaccination before the end of this calendar year, fully aware of the fact that a new wave might come up sometimes in January and February. So let's have the vaccination done before that. And that's the guidance and the direction of the Chief Minister, under whose leadership we are carrying it out.
Thank you very much, sir, for this wonderful conversation. On behalf of the audience, I would really like to congratulate you and, through you, the entire state for this wonderful accomplishment. There is so much that we have learned today. Thank you, sir.
Mr. Ghosh.
Thank you, sir.